Essentially, in a brow lift operation, it can be described as elevating the tip of the eyebrow, specifically the outer 1/3, in an upward direction. Basically, two different methods can be used in brow lift surgeries: the endoscopic method and the classic method. I usually choose the endoscopic method for brow lifts, because in my opinion the endoscopic method should be preferred in brow lift surgeries, both in terms of the feasibility of the surgery and because the recovery period is faster. And it is the primary choice in my professional practice. Just like in all my surgical procedures, achieving a natural outcome is a key priority for me when performing brow lift operations. Frankly, I absolutely do not favor or enjoy performing operations that lift the eyebrows extremely high, making them look almost alien-like. Lifting the portion of the brow that has drooped downwards, whether the person is male or female, gives a more rested, more vigorous, more vibrant expression. In this operation, in brow lift surgery, instead of solely elevating the brow tip, I greatly enjoy making even minimal adjustments to the meeting points of our upper and lower eyelids, and I favor doing so. This is because if the junction point of our upper and lower eyelids in particular remains in this state, it results in an expression that appears somewhat fatigued and somewhat dull. I much prefer the axis at this junction point to be very slightly directed upwards, besides the rested, vigorous expression and the more vibrant look, since it will also be aesthetically pleasing, especially during a brow lift procedure. While touching the brow area, transferring this area very slightly upwards within the limits of naturalness, in my opinion, enhances the aesthetic quality and result of the surgery. Quality and result very much improves and increases it. We conduct this procedure using general anesthesia within the sterile environment of an operating theater at the hospital. The average surgery time is 1 hour, and the patient can even be discharged the same day after the surgery. Since the surgery is performed through the scalp, patients do not experience any issues related to scarring. After this surgery, it is necessary to apply a plaster bandage, especially to the forehead area and the brow area. We remove this after an average of 3 days so that the swelling and edema in that area can heal more quickly. And after 3 days, patients to their daily social lives or work lives will be recovered enough to return at the latest after 5 days. Eyebrow, in any case, will be achieving a more lively, more rested and younger looking appearance for you.